For our project, we are going to be discussing myositis ossificans and the role that it plays in the body. Myositis ossificans is a condition where bone tissue forms inside of muscle or muscle tissue after a traumatic injury. In this podcast, we will discuss the general structure of the skeletal system, discuss myositis ossificans, one disruption to homeostasis, and how it relates to other places in the world. Hopefully, we aim to share some knowledge and information with our peers during this podcast. So to start off, we're just going to go over and review the structure and function of the skeletal system. So the skeletal system is divided into two major systems. You've got your axial skeleton, which can be known as your trunk, which includes your skull, spinal column, ribs, and sternum. Then you have your appendicular skeleton, which basically accounts for all of your appendages, which involves your lower extremities, your upper extremities, your shoulder, and your pelvic girdle. There are different types of bones in the body. You've got long, short, flat, and irregular. Your femur is an example of a long bone. A short bone can be your carpals. An irregular bone is your vertebrae, and your flat bone is your sternum, for example. The skeletal system has 5 basic functions. You've got blood cell production and storage, protection, movement, structure, and blood cell storage. The skeletal system gives your body its basic shape. Without the skeletal system, your body would literally be, for lack of a better term, a sack of tissue and fluid. Bones are essentially the framework for your body, just like beams are the framework for your house. So following structure, the skeletal system allows the body to perform movement. Bones are a place of muscle attachment, and they act as levers and pulleys for movement. You can view it as your joints are your fulcrums and your bones are your levers providing a system of movement. So following structure, your skeletal system also plays a really big role in protection. So it protects many things, including your brain, your spinal cord, which are protected by your skull and your vertebrae. It's very important, and your ribs also are super important in protecting your really vital organs, such as your heart and your lungs. Your rib cage is actually super flexible so that you're able to breathe. And the next 2 functions are more internal, and we cannot see these with the naked eye. So we have blood cell production and blood cell storage. So blood cell production occurs in red marrow. It creates both red and white blood cells. At birth and during adolescence, all bone marrow is red, and as you age, most of your bone marrow turns into yellow marrow, which houses fat cells and triglycerides. In adults, usually long bones contain the yellow marrow, and the red marrow is found in the flat bones of your hip, your skull, your shoulder, and your vertebrae, and at the end of long bones. In the event of severe blood loss, your body can convert that yellow marrow back into red marrow to increase blood cell production. The body uses calcium and phosphorus for bodily processes like muscle contraction. We find these minerals in both our diet and from our bones. When they're lacking from our diet, that's when your bones play a role in that calcium. You have osteoclasts, which break down your bone to release calcium back into your body. Vitamin D is also found in our bodies, but also vitamin D is through your skeletal system as well. Without vitamin D and calcium, we can lead to some issues such as osteoporosis, which is the decrease of your bone, a lack of skeletal tissue. So when bone is first cartilage, which happens when the baby is developing and the skeletal system becomes organized into a framework of cartilage. And then after birth, your cartilage begins to harden into skeletal tissue. This process will continue through your life in old age. Your bones become brittle as you get older, and the process of bone hardening is called ossification, and that happens basically through the process of osteoblasts, which are bone producing tissue. Your osteoblasts produce your bone tissue, which is called osteotissue, and secretes the enzyme phosphate, which allows that calcium salt to be deposited into the new bone tissue, which will calcify and turn into that hard bony tissue that we all know as our bones. So once that bone tissue is hardened and calcified, your osteoblasts turn into mature bone cells, which are known as osteocytes. And your osteocytes sit in the small cavities called lacunae, which are connected by caniculi, and that whole lacunae and caniculi that go around in a circle is known as your lamellae. So further, just to wrap up our functions, we've got protection, movement, structure, and that development of your blood cells. So now that we've talked about that, we're going to move into the actual process of myositis ossificans. So myositis ossificans is a condition where your muscle tissue is replaced with skeletal tissue. So it's usually most common after an injury, and it's most often seen in athletes and in your larger muscle groups. So stiff fibrous tissue grows within the muscle or your ligaments that are prone to injury, and usually takes place in an area that's repeatedly struck or prior to a direct trauma, such as a car accident or an abrupt fall. According to the Healthline, 80% of the time, myositis ossificans occurs in your thigh and upper arm muscles. So big idea, repeated trauma to the same muscle system, muscle area, such as the inner thighs of a horseback rider and the bicep region of a football player. That's when muscle ossificans comes into play, and those bony-like projections in that muscle tissue are super harsh on the body in its state of maintaining homeostasis, which we will get into now. So in homeostasis, when everything is running according to plan, after you get injured, you develop a strain or contusion, and it returns back to its normal state of health after a few days through the work of fibroblasts, which are your muscle tissue cells. So when myositis ossificans occurs, your body makes a mistake within your healing process. Instead of that fibroblast being sent, which are your muscle-making cells, instead of those being sent, osteoblasts are sent, which form bone tissue. Then your body creates a deposit of immature bone cells inside of that muscle tissue, which will cause a super, super big problem, especially as that situation increases. So myositis ossificans will often present itself in patients in one of the two forms. We have circumscriptia and progressiva. To begin, we're just going to focus on circumscriptia. So this version is known as benign, solitary, self-limiting disorder representing metadysplasia of soft tissue to bone. So basically that just means like an irregular function of tissue. So that would be the muscle tissue turning into bone. So this can be either, like we said, this is that typical type. It can be related to that trauma, that repeating trauma to that one central area. Your skeletal tissue starts to begin to replace muscles, tendons, ligaments, fascia, aponeurosis, and a heterotrophic bone, rendering movement impossible. So in that normal state of homeostasis, you get that hematoma, that blood pooling, that contusion, the bruise. And then your blood vessels constrict, attempting to stop blood supply, that's where you get your scab and your clot. After that, you get a little bit of inflammation, which allows for nutrients to be supplied to that area so the wound can rebuild itself properly. And it's during that phase, which is the proliferative phase, that the circumscriptia myositis ossificans, if it's going to happen, it will occur there. Instead of that fibroblast being sent, like we said earlier, that promotes that connective tissue growth, that muscle tissue growth, osteoblasts are sent, now sending bone remodeling and those osteoblasts, which in that injury, that gap is filled with immature bone, creating that new set of problems for a patient. So in the other type of myositis ossificans, the progressiva, which is also known as fibrodysplasia ossificans progressiva, that is super rare. in the realm of Myositis ossificans. This is a autosomal trait with clear expressivity. It's a genetic and hereditary connective disorder that over time changes skeletal muscles, tendons, ligaments, fascia, aponeurosis into that heterotrophic bone, which renders movement impossible in the long term. Over this course, you have flare-ups or phases of pain during early childhood while this process is taking place, while that muscle tissue is being replaced with skeletal tissue. It takes a super big toll on the mobility and overall well-being of your patient. Just imagine a young kid not being able to run around freely or carefree because their skeletal system is literally failing on them. The muscles attached to the bone are slowly turning into immature bone, decreasing the range of motion, and that becomes extremely limiting. Most patients are wheelchaired by the end of the second decade of their life, so late 20s, and they commonly die of complications of thoracic insufficiency syndrome. So when your muscle system, is being replaced by bone, that creates a big problem for a lot of issues with movement, protection, and just overall with your whole homeostasis system. So you're super sick. Now we're going to move on to kind of how myositis ossificans is looked at and viewed in other places in the world. So we're going to look at two different people. This is kind of most relatively how myositis ossificans is presented in the healthcare industry. So for case number 1, we have a 20-year-old college student. They have myositis ossificans traumatica develop after a fraternity hazing. So the patient was being struck repeatedly on both of his thighs while standing at attention, and he was presented with bilateral thigh pain and stiffness 6 weeks after the incident. Radiographs showed extensive new bone located adjacent to the anterior and lateral aspects of his left femur with less involvement of his right thigh. So that is where his muscle tissue in his thigh has been replaced with skeletal tissue. Then for our other case, we have a young soccer player who was diagnosed with myositis ossificans 6 weeks after a muscle strain in the right thigh. Radiographic and sonographic investigations initially helped to confirm diagnosis and later supported clinical movements. We present our approach to the case and discuss pathopsychology, prevention, and treatment of this rare condition. So taking it further, we're going to look at football and soccer, which are two pretty contact-heavy sports, and we're going to see how those kind of play out. So according to the NCAA, the overall injury rate of football is 8.1 injuries per 1,000 athletes exposures in games and practices combined. So football players are nearly 7 times more likely to be injured during a game and practice. We have ligament sprains are the most common. More than 30% of all injuries are with lateral ligaments and of the knee in particular. And concussions are also super important in injuries of college football players. So the greatest point of this is it's super heavy contact sport. We have a lot of potential for myositis ossificans development in this, as well as soccer. So soccer, super contact once again. Muscle strains make up 25.8, followed by ligament sprains, followed by contusions and concussions. The most common type of injuries are ligament sprains of the lateral ankle, hamstring muscle sprains, which again, those are those really big muscle groups. So that's super a great place for that skeletal tissue to develop in those big muscles. So it's in these contact sports where you find most cases of myositis ossificans in the United States. Professional college football are considered to be the most watched sport. Football is the leading cause of injury based off the high contact. Soccer is another sport in the United States that has a vast amount of injuries. Soccer is a variety of ligament injuries as well as an over amount of contact. So just to look at another sport, we're going to specifically focus on rugby in the UK. That is another super contact sport. 1 in 4 rugby players will be injured during the season. 20 to 40 tackles per match. Neck injuries are super common. 25% of these are caused when players are differing levels of experience tackle. There are particular traits that are identified to increase risk factors for rugby injuries. Being a lower ranked or less skilled can play a big role in that. And rugby is estimated to be almost 3 times higher for an injury rate than football. And then according to First Aid for Sports, over 40% of injuries are muscular strains or bruising. So that in hand is super big for myositis ossificans. A lot of superficial injuries and a lot of contact in rugby. So rugby is very common in the United Kingdom, and there are a lot of professional teams that face a lot of tough competition. And myositis ossificans can be developed in all 3 of these really high contact sports. In many cases, rough tackles, devastating bruising, and over time that can definitely contribute to myositis ossificans. So myositis ossificans can affect everyone in different ways depending on the sport you play or just your everyday usual activities. Hopefully, throughout this podcast, we were able to give a little bit of an idea of what myositis ossificans is, how it plays a role in the skeletal system, and disrupts homeostasis and how it relates to other places in the world. Thank you.